I'm Becky Latch from the Department of Pediatrics, and I'm going to share a few tips with you about teaching medical students. First, you should set your expectations early and revise them often. No one likes working without guidelines and clear-cut goals, and students especially don't like being evaluated on goals that they never knew they had. A 5-minute conversation at the beginning of your interaction to get to know your student and to set your expectations will provide them with a great basis for the rest of your time together. Secondly, always make time for feedback. Every learner wants to know how they're doing and what they could do a little bit better. And if you've set some clear-cut expectations, giving feedback gets much easier. Sometimes it's helpful to think of yourself as a coach who is constantly giving advice to tweak your athlete's performance. Make sure you use the word feedback so students know what you're doing. Next, think about priming to set students up for success. Priming is a strategy where you help a student prepare for an interaction. For example, before you send the student in the room to see a patient with asthma, help the student list important questions they should ask. Or in a situation where the student is only an observer, prime them by giving them something specific to observe. Lastly, and most importantly, own your teaching role. Studies show that residents do up to 80% of the teaching of students. You may feel like you don't know enough to be a good teacher, but I promise you, you know more than you think. For each patient that you see with a student, pick 1 or 2 pearls to give the students. Most people think about a pearl being a piece of medical knowledge, but a pearl can be a clinical skill like how to hold your otoscope, or a communication tip like always sitting down when you're talking to patients and families. If you can keep those 4 tips in mind, you'll be a rock star resident teacher in no time.